My name is Dr. Erichardt. I'm a geriatrician here at Boston Medical Center. Now, a geriatrician is somebody who specializes in taking care of the elderly, which in America we define more or less as 75 and up, even though they will try to convince you that you're elderly when you're 65. We don't really think of that as old. 75 to 105, now we're talking. My own training is in internal medicine. I trained in cancer medicine, which is medical oncology, and I also work as a hospice medical director and do what we call palliative care, end-of-life care. I'm also trained and certified in geriatrics, which is what I do here at Boston Medical Center. And my work week includes house calls 2 or 3 days a week and seeing patients in clinic and taking care of patients in the hospital. And your director here asked me to come by and talk to you a little bit about some of the things that are different about geriatric medicine. And we don't have a whole lot of time, but I will say they're really what we call the big three. There are three issues, general areas in medicine that are very unusual for young people to be worried about these or to be affected by these. But for the elderly, they're the things that we see the most common, and they're even things that people worry about even before they have them. And the three areas we're going to talk about are the area of dementia, what we call cognitive impairment, memory loss, and that type of thing. The second one is problems with walking and mobility, and specifically falling. And the third one is urinary incontinence, or inability to hold on to your urine like you used to. And we'll make a few comments about each one. But in general, I'm going to say certain things are true of all three. Number one, I think about it, I would say many elderly people and many younger people think of these three things, dementia, falls, and incontinence, as part of normal aging. There are people that are feeling these symptoms. They're not telling their doctors about it. When the doctor asks if they have any problems, they say no, and they're not lying. They just feel that this is normal and expected, so why report to the doctor something embarrassing like the fact that you have to wear what some people call diapers and we like to refer to as incontinence briefs. So these three things, if you're developing them, if you have symptoms, don't hide them. They're not part of normal aging, and you should report them to your doctor. We don't go crazy in geriatric medicine. We're not looking for people to operate on and experiment on. But these three things, dementia, falling, and incontinence, are often things that we can improve and sometimes get rid of totally. Frequently with some medications, some creams, sometimes by removing medications that have aggravated these problems. So you shouldn't be worried about those three things. Report them to the doctor. They're not normal, and the doctor will look for causes and then look for a way to make them better. Let's start with dementia. And remember, this is very common, but not considered part of normal aging. And people kind of have this argument back and forth. In America, by the time you're 85, you have about a 50-50 chance of having some significant decrease in your intellectual functioning. All right, so that's kind of a scary thought. By the time you're 100, if you're that lucky, I hope you are, it's even higher. Now, we have a big debate in geriatrics about what's normal, and we have something that we call, it has various names, we call it age-associated memory impairment. And this is, the typical of this is, I believe that I have that now. I can't remember the Latin declensions that I knew in high school and that I thought I would never forget. I don't know enough algebra to help my daughter with her homework. And occasionally I forget people's names. And this worries me, but this is the kind of thing that we consider to be probably part of the normal aging process. Now, there are a few things that are important to know about the mild memory loss of normal aging. One is that it's not associated with any other kinds of trouble with mental functioning. The areas that we look at are, all right, we've already talked about memory. Now, what about personality? So if you have mild memory loss associated with normal aging, you shouldn't have any personality change. You shouldn't have any particular language dysfunction. So you shouldn't be having trouble speaking or reading or understanding language any more than you've always had, if you've had any. You shouldn't have what we call visuospatial trouble. So things that require manipulating your hands and drawing things.